Hello everyone, welcome to another session of Ideas. In the last video, we talked about the role of government during a healthcare crisis. We learned that how government collaborates with international organizations to manage a healthcare crisis. In today's video, we are going to talk about that how different approaches taken by the government across the world led to different outcomes. Let's try to understand that by taking up the example of COVID-19. So during COVID-19, government were tasked with certain jobs. One such job was formulating and implementing healthcare measures to control the virus. Also to protect public health and mitigate the economic impact. The responses varied because of several factors such as difference in public healthcare infrastructure, political system, cultural norms, and economic conditions. And because of these differences, the outcome was also different. Let's take up example of few countries to understand this better. Denmark is a constitutional monarchy which has kings and queens, and their power is limited by constitution. It is a democratic country which has rich history and culture heritage. By 2020 data, it had a population of 5.8 million. Let's see how Denmark successfully managed COVID-19. Denmark had low death and infection rate during COVID-19. It was one of the first European countries to partially reopen after lockdown. It was also one of the countries which quickly imposed a national lockdown and closed its border. Few factors which led to successful management of COVID-19 were fast and forceful response. Government acted fast by imposing a national lockdown and closing its border. Economic and social protection. Government paid a part of the salary of citizens who were working in private companies to prevent large-scale layoff. The healthcare system is free and accessible for all in Denmark, which also helped citizens during COVID-19. Public healthcare sector is strong, large, high quality, so it was able to cater to the increased demand for treatment during COVID-19. Let's try to understand COVID-19 management by another example of Vietnam. Vietnam is a single-party authoritarian system which has absolute authority. What did Vietnam do to manage COVID-19? Let's find out. Vietnam's strategy was informed by their past experience in 2003. The Prime Minister prioritized public health over economic concern. The government used military, grassroots organization, and public surveillance to ensure that public health measures were strictly followed by the citizens. Health risk assessment was conducted after China reported cases to WHO on December 31st, 2019. National Steering Committee and National Response Plan to manage COVID-19 was created in January 2020. Now, Vietnam's strategy to manage COVID-19 went through different stages. There are mainly three stages. First stage met with early success. Second stage experienced peak of pandemic, and the third stage, the government focus was on vaccination. Let's try to understand these stages better by a detailed discussion. Early success. Government achieved early success during stage 1 because of active testing, contact tracing, strict quarantine, and infection prevention measures. Early detection was possible because of the information they received from China. Government also implemented stricter measures than the one which was suggested by WHO, which included mask wearing and widespread sanitization. Second stage. During second stage, there was a peak of pandemic. Vietnam experienced rapid increase in cases despite taking strict measures. Public health and social measures were insufficient during stage 2. These challenges were experienced by Vietnam because of many factors, such as lack of data about the new variant, Delta variant, inadequate vaccine supply, overconfidence from previous success, and insufficient medical equipment. During stage 3, the focus of government was on vaccination and educating people for vaccination. And thanks to that effective communication, the willingness to get vaccinated among citizens also improved. Now let's talk about India. India is a democratic country. The first case was reported in Kerala on January 30th, 2020. And on 24th March 2020, government announced a 21-day strict lockdown after 9 deaths and 519 confirmed cases were reported. People were given 4 hours to prepare for lockdown. What were the challenges faced by India during COVID-19? India had second highest confirmed cases and third highest deaths globally by March 2022. During election campaign, cricket events and religious gatherings, public health measures were not strictly followed, such as social distancing. So poor pandemic management was also a challenge. Poor healthcare infrastructure like unavailability of hospital beds, oxygen, medical services during COVID-19 added to the problem. Other contributing factors were high population density and socio-economic condition of the population. Then what did India do? India focused on vaccine development and mass vaccination. Covishield and Covaxin were developed for vaccination and over 1.83 billion doses were administered by March 2022. So in today's video, we talked about that how different countries took different approach to deal with COVID-19 and as a result had different outcomes. Now is the time for your task. According to you, which country dealt with COVID-19 the best? Share your reason with evidence. That is all for today. I will see you in the next video very soon. Till then, take care. Happy learning.